Albenza is a medication used to treat certain tapeworm infections, such as neurocysticercosis and hydatid disease. It is important to take this medication as directed by your doctor. The dosage and duration of treatment will depend on your medical condition and response to therapy. Albenza is usually taken with food twice a day for 28 days, followed by a 14-day break. It's best to take Albenza at the same times each day to help you remember. Always consult your doctor for the best time to take Albenza based on your individual needs. When taking Albenza, it is important to follow your doctor's instructions. Typically, it is taken by mouth with meals, usually 1 to 2 times daily. If swallowing tablets is difficult, you may crush or chew the dose and take it with water. For certain conditions, such as hydatid disease, your doctor may prescribe a treatment cycle, which could involve taking the medication twice daily with meals for 28 days, then stopping for 2 weeks. It is crucial to carefully follow your doctor's instructions. The dosage of Albenza is based on your weight, medical condition, and response to treatment. It is important to use this medication regularly to get the most benefit from it. Try to take it at the same times each day, and if your doctor instructs you to take it in a treatment cycle, mark your calendar as a reminder for when to restart the medication. It is important to continue taking Albenza until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Your doctor may also prescribe other medications for your condition, such as corticosteroids or anti-seizure medications, which should be taken exactly as directed. While using Albenza, it is best to avoid eating grapefruit or drinking grapefruit juice unless your doctor or pharmacist says it is safe to do so, as grapefruit can increase the chance of side effects. If your condition lasts or gets worse, be sure to inform your doctor. Some common side effects of Albenza may include nausea, vomiting, abdominal pain, headache, or temporary hair loss. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as severe headache, vision changes, yellowing of the eyes or skin, severe stomach or abdominal pain, dark urine, unusual tiredness, easy bruising or bleeding, signs of infection, signs of kidney problems, confusion, or a very stiff neck. In the event of very serious side effects, such as seizures, it is important to seek immediate medical help. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it is important to contact your doctor or pharmacist. Before taking Albenza, it's important to let your doctor know if you have any allergies, especially to other benzimidazole anthelmintic drugs, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. It's also important to inform your doctor about your medical history, especially if you have liver disease, biliary tract problems, or blood/bone marrow disorders. Albenza may cause liver problems, so it's important to limit alcoholic beverages while using this medication. It's best to check with your doctor or pharmacist for more information. If you're planning to have surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor. You should not become pregnant while using Albenza, as it may harm an unborn baby. Your doctor may order a pregnancy test before you start this medication and may also discuss reliable forms of birth control while using this medication and for 3 days after the last dose. If you do become pregnant, it's important to talk to your doctor right away about the risks and benefits of this medication. Additionally, Albenza passes into breast milk, so it's best to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Albenza. This medication can affect how other medications work and may increase your risk of experiencing serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If you suspect an overdose and the person is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Do not give this medication to anyone else. Albenza has been prescribed specifically for your current condition. Do not use it for any other infection unless directed by your doctor. Before starting and during the course of taking this medication, your doctor may require you to undergo lab and/or medical tests, such as liver function tests and complete blood counts. It is important to attend all medical and lab appointments. Please consult your doctor for more information. If you forget to take a dose of Albenza, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It is important to store Albenza at room temperature, away from light and moisture, and not in the bathroom. Keep all medications out of reach of children and pets. Do not flush Albenza down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.